Hi, everybody. My name is Miranda, and I wanted to talk to y'all today about interprofessional collaborative practice. I want to say it's a big topic right now in the dental hygiene community. I've gathered a lot of research and read through numerous articles and have attended a couple of courses on it. And I really wanted to share with y'all some of the stuff that I've found, some of the key points that's really important, in my opinion. First of all, this is me and my family. I moved to Houston 12 years ago after hygiene school. I graduated from Del Mar College in Corpus Christi in 2006. And then right after my husband and I got married, we had two little kids. Leland's 9 and Weston is 7. And I've been practicing for 12 years. I took a little break for about 3 months just to kind of regroup and see what I wanted to do with my life. That actually led me to continuing my education, and that's what I'm doing right now through St. Petersburg College in Florida, and I'm about to wrap it up. So I appreciate everybody for answering my questions and letting me kind of tag along with you guys this semester. It's been really great, and I'd love to listening to y'all's stories and helping you out as much as I could. So during the presentation or after the presentation, I want y'all to be able to describe interprofessional collaboration. I think you will definitely know how to do that after this is over. We're going to go over 3 types of patients that would benefit from interprofessional collaboration. Most definitely, it's not only 3. There are so many patients that would benefit from you collaborating with other healthcare professionals about their overall health. And then at the end, I want y'all to look at a case study and be able to work through it with one another and see what other people have, your peers have as ideas, because one of you may think of something that not even I've thought of. So that's really good for y'all to be able to do. I liked this quote from Steve Jobs. I mean, you really can't get anywhere without help. Nobody can do it on their own. So I thought that was a really good quote from him. So intercollaborative. You'll notice throughout the whole presentation that the words are very interchangeable. You'll hear interprofessional collaboration, or interprofessional education, stuff like that. On this, right here, this is the World Health Organization's definition. I didn't find too much different from this. So whenever you're talking about education, you're talking about the students of 2 or more professions learning with each other, about each other, in regards to their overlapping roles and, helping a patient out and helping them with their overall health. This semester, our class had the opportunity to work with some nursing students on a case study, which was really good because we were able to see their ideas, and they were able to hear our ideas. And like I said, that was some stuff that we've never heard of or didn't think of, and they did. So it was really nice to be able to kind of bounce ideas off of one another and come up with a really good solution for that patient. And then interprofessional healthcare collaboration is whenever you're out in the real world, you'll be working with other medical providers. So, for instance, you'll see a client in your office and they'll, have a heart condition. So you'll want to work with their cardiologist and stuff like that. So it's a partnership between a team of healthcare providers, not just 2, it could be more than 2, obviously. And you're sharing decisions and making the best decisions for your patient with the patient too. So then and then. You will see why I labeled this the then and then, because there hasn't been too much going on since 2015, but the history of intercollaborative education starts with the World Health Organization in 1978. They started promoting it, and they have only recently focused on the inclusion of oral health care. So after 1978 of them saying, oh yeah, I think it would be good to include dentists and dental hygienists and oral health in a patient's overall health, they waited 28 years. And then in 2026, they started doing some extensive research, and it was finally recommended that interprofessional education needed to be included with the curriculum. So curriculum of medical professionals, including pharmacists, dentists, cardiologists, just everybody nursing, whoever's looking in, included in medical education. So after that it was finally recommended, they waited 5 more years, and in 2011, the American Dental Education Association and the Interprofessional Education Collaborative held a session where core competencies were decided. So they came up with a set competencies to where they said, this is probably what we need each medical field to know so we can collaborate with one another in the real world. So the Interprofessional Education Collaborative is an organization that was formed by 6 national education organizations like the ADEA, the American Dental Education Association. And it included public health, pharmacy, nursing, dentistry, allopathic medicine, and osteopathic medicine. So that's where it started. And they're still very, very interested in adding interprofessional collaboration into the education of medical professionals. So a couple of years later, between 2013 and 14, the topic has gained momentum. Like I said, I've been to a CE about it. So CE's articles, symposiums, workshops, a lot of noise out there about the topic. However, in 2015, there was a report that stated that interprofessional education is not appearing to be an essential part of the education in dental schools. So there's still a roadblock, which we will kind of look at later. So like I said, you'll hear some interchangeable verbiage. Multi-professional is also something, multi-professional collaboration. So with the nursing and dental hygiene link, both of those practices are involved in knowledge-based assessment, planning, intervention, evaluation, teaching and counseling and direct care, research, policy, and advocacy for patient populations and communities. So the one thing that I asked myself whenever I read this was, how much do nursing students spend on oral health? Because when we go to hygiene school, we have pharmacology and we know everything there is to know about pharmaceuticals. I'm assuming as much as what nurses need to know because it's very extensive. They take pharmacology too. We all take A&P, we all take biology, we all take a pathology course. We probably focus more on oral conditions as far as pathology, but still know a good baseline. So I kind of asked myself, how much information does a nursing student get when they are in nursing school? This is a picture of one of my friend's little guys, TJ, came into the office. He was such a good patient. So what does that mean for dental hygienist? Well, we use a process of care to assess needs, plan and implement care, and evaluate outcomes. So we have a set process that we use, and so does a nurse. A nurse will see a patient and, devise a plan and kind of have the doctor come in, and they already know, just like we already know what's about to happen. They already know what's about to happen too with that patient. We are professionals who collaborate with the dentist and other healthcare professionals. So for instance, if you have a patient with a heart condition, you could collaborate with the cardiologist. If they're taking blood thinners, you need to probably be that person that calls the cardiologist, or at least the office, to see, do they need to stop taking blood thinners? Stuff like that for any kind of dental work. And then we're responsible for services that include some of the more difficult techniques to master in oral healthcare. Hello, we are the only people that can do scaling and root debridement. Nobody else can. Nobody else is allowed to do this, just us. And then we are definitely accountable for the patient. We're their advocates. They trust us. They like our opinion and our judgment. We fulfill our role through functions of clinician, educator, manager, advocate, and researcher. We advocate for them. We research for them, whatever they want. We help them manage their treatment. They come to us. I know because I've been doing this for 12 years, and they want to know what the hygienist wants to know what she will do, and they're gonna really depend on you for the answers or as that crutch, and they're gonna want to know what you would do if you were in their situation. And then all of our actions are evidence-based. We know where to look for the legit answers. We know where not to look. We know that when a patient comes in and says, I read a story that you're not supposed to floss, or it's not good to floss, we know that is wrong. We know where to go to say, well, this is research, and it's evidence-based research that says flossing is what you're supposed to do every day. So I told you we were going to go over a few patients that needed some intercollaborative help. First, coronary heart disease, very, very big. It's the leading cause of death in the United States. There's up to 600,000 deaths annually. And I read from the American Heart Association's website that every 60 seconds, one person dies from a heart attack. But every 34 seconds, somebody has a heart attack. So that means almost half the time, if you have a heart attack, you're going to die. So those numbers were huge to me, and it's the leading cause of mortality in the United States. So this is a big one. Something that you'll look for whenever you have a patient and you're looking at their medical history are medications. And a few common medications for heart disease are they'll be put on blood pressure medication. So many patients are on blood pressure medications. Blood pressure medicines like ACE inhibitors, lisinopril, enalapril, Benicar, those are very, very popular. You'll see those daily. And then there's also the beta blockers like Toprol. You'll see that very, very often. And then you'll also see patients who are on diuretics like furosemide and spironolactone. You'll know once you see those that they have some condition with their heart. Periodontal disease is an independent risk factor for coronary heart disease. So an independent risk factor, it means that it has it significantly contributes to an outcome. So research states that periodontal disease significantly contributes to coronary heart disease. So whenever a patient comes in and they have this, you want to definitely share with them the what is, the correlation between the two. The second one is diabetes, also very, very big. 70,000 deaths annually, obviously not as much as heart disease, but this is like number 2. The big one is type 1 diabetes, especially in our situation where we're seeing patients in a clinic. That's where you're going to have a problem with a diabetic patient, is if they're type 1. So the people with periodontal disease, they have poor glycemic control. That means they have high blood sugar in their blood. They can't control it. The periodontal disease, it definitely affects the control of their glycemic count. That's when they go check their A1Cs. If it's below a 5.7, that's good. You want it to be below a 5.7. Anything a 5.7 to a 6.4 is pre-diabetic, and an A1C of 6.5 or above is definitely diabetic. You'll also see a whole bunch of patients on these kind of meds, unfortunately. Insulin, like Nuvolog or Humalog. And then if they have type 2 diabetes, they'll be on metformin. I see this way too often. There's a lot of complications from diabetes, and they're more prevalent in people with moderate or severe periodontal disease. And then periodontal disease may also result in insulin resistance. So they can't control their insulin, and that's when they go into this shock. Some complications from diabetes could be, they could get cardiovascular disease. So then you have somebody with diabetes and then they have cardiovascular disease, but they also have periodontal disease. So this is an opportunity for you to have, 3 different people in collaborating on their health. And it would definitely benefit them. Oh, you have periodontal disease? Well, I noticed that you are taking metformin and you are also taking this blood pressure medication. You know that the periodontal disease can affect your heart and, or, your diabetes and, stuff like that. So this is definitely a conversation you want to have with them. They could also have kidney damage. The kidneys can't filter the blood the way it should. Eye damage, everything becomes blurry. They can maybe have hearing impairment. They can, if they're saying, what, that, that's a good indication that the diabetes has affected their hearing as well. And then of course, they get those sores on their feet, which I've never seen in real life, but it looks very painful. Okay, so respiratory infections. I put this little picture in here because I thought it was very helpful whenever I was going through my presentation. I thought it would be great for y'all to see this. COPD is the 3rd leading cause of death in the United States. And you'll see patients on these medications too, albuterol inhalers like Flovent. So COPD can include emphysema and chronic bronchitis. Both are caused from smoking. There's actually no cure for COPD. There's only treatment to suppress it. So if your patient says they have COPD, it's forever. So they're going to have to be seen more. You're going to have to collaborate with somebody probably on this. So it involves the aspiration of bacteria from the oropharynx to the lower respiratory tract. So, unfortunately, The oropharynx is not labeled, but it's right here below the nasal cavity. And the bacteria goes in through, and then it comes out of the little primary bronchi into the lungs, and that's how the bacteria gets into the lungs. The most common hospital-acquired infection is ventilator-associated pneumonia. You'll see patients occasionally who have been in ICU or have been in the hospital for long periods of time, and they've acquired COPD or pneumonia, excuse me, from being on the ventilator for so long. So the periodontal relationship between COPD and periodontal disease is that they both have loss of connective tissue. So if you have COPD, more than likely you'll see that the patient does have periodontal disease. Okay, so this is the case study. I'm gonna try to go over a little bit for y'all, so y'all can get a good idea of what you're gonna be looking at in the discussion board. So today's patient is Lauren. She was in the office about 6 months ago, and she had a cleaning and examination. Everything was fine. She talked about her workout routine. She's training to run a half marathon with her friend. So this time you're walking up to the front of the office to get your patient, and you notice that she is very, very, very skinny, noticeably. The chief complaint, you ask her mom, is there anything you have issues with, or your do y'all have anything that y'all want addressed? And they're both concerned that she has some little chips on her front teeth, and they pointed at 7, 8, and 9, and Lauren is interested in getting her teeth whitened. So you have her seated, take her blood pressure, temperature, and you start reviewing her medical history again. Her blood pressure is, normal for a 16-year-old. Her pulse is very high. Her temperature is a little elevated, nothing to be concerned with. She doesn't take any medications, and she doesn't have any allergies. But she's a type 1 diabetic. And her mom reports that her most recent A1C is 6.5, and it's way higher than usual. You take 4 posterior bite wings. You don't see anything on that. The doctor doesn't see anything on that. But you notice a class 5, you notice class 5 decay on the lingual of 7 and 10. So as you recall, class 5 decay is on the gingival margin, either on the lingual or on the buccal of, or the facial of the tooth. So right at that gingival margin of 7 and 10 of the lingual, the back. And you get an anterior PA, because you kind of notice that. You get a couple anterior PAs, and you notice also that she has decay in between 8 and 9. Then you start doing an intraoral examination, and you notice that she has a traumatic lesion on the patient on her soft palate. So you start talking to Lauren just to kind of get an idea of what's going on, and she just doesn't seem like she's her bubbly self anymore. She tells you that she's very tired, but she has almost reached her goal of running 13 miles. So she's kind of excited about that, but she's still not like her perky, energetic self. So these are the questions that are going to be on the discussion board. And I'm going to kind of review them a little bit. I'm going to try not to give you too many answers, because I want y'all to kind of work through this yourself, and I'm going to see, what y'all come up with. Do you suspect Lauren has a problem causing her dental issues? If so, how do you proceed with the treatment? How do you want to proceed? Do you want to ask her some questions? Do you want to talk to mom? Do you want to see if Lauren's going to, tell you, anything that's going on? What's your dental hygiene diagnosis for Lauren? Kind of work through that in your head. I can't wait to hear your answers on this one. I'm sure everybody's going to have a little variant on this. And then I want to know some goals for you that you have for her success. When you think about this, what are some things that you'd like to see from Lauren at her next visit in 6 months? And then I'm going to kind of go through this with you because I think it's really important to kind of get a ground idea of, some of the key players that would help with her treatment. So Lauren, the patient, I'm going to guess that y'all already know she has bulimia, that she's suffering from bulimia. So we're going to have a psychologist involved. You want to, once you talk to mom and talk to Lauren, she's a minor, about, what's going on with her and her body and how it's affecting her oral health, you want to remind mom that, first of all, she needs to get her A1C levels in check. So the medical components are going to be like her endocrinologist, the one that takes care of her for her diabetes, maybe even her general physician. She probably needs a physical if she's lost a lot of weight in a short amount of time. That's not good. She probably needs to see a psychologist or a counselor. They can help her work through underlying mental issues. Is she struggling in school? Is she being bullied? I know 16 is such a hard age for girls, and things that they see on social media and stuff, it just makes them want to fit in and be super skinny, and you just, is she being bullied? Has somebody told her she's fat? Then family and friends, obviously, you want to have that social aspect. Maybe Lauren's friend, one of Lauren's friends is going through kind of the same thing. So they can kind of work through this together. It's great to have somebody there for you all the time that understands where you're going through and has been there. And then you might want to have her or consult with a nutritionist, or collaborate with a nutritionist on this. You want to have her discuss her diet, the right and wrong foods, since she has this idea that she needs to lose weight. Well, this is how you do it in a healthy way. See a nutritionist, and they'll help you maintain a healthy weight and still be happy with your appearance. And then obviously the dental hygienist for the cleaning, and not just that, but you're her advocate now. You're her manager, and you're going to help her and make sure she gets the right care that she needs. And then the dentist, because they're going to have to restore her teeth. She has some decay and some discoloring. She wanted her teeth whitened. So, and the fractures on the front. So these people all play a really big role in her care. So there are some hurdles with interprofessional education. Healthcare functions they have not completely adopted the interprofessional education system. It's just they have the change is very slow, and they have a really hard time of when to introduce interprofessional education into their curriculum, because there's already an overwhelming amount of information that you need to learn during whatever medical field you're going into. It's really hard for the instructors and the directors to say, hey, let's throw this in there too, and how to properly throw it in there without overwhelming students at that time. So there's a lot of values and expectations and goals that go into interprofessional education that just hasn't been completely thought to be 100% needed right now in education. But there are some solutions. There's research that says the earlier the interprofessional education is introduced into the curriculum of the fields, all medical fields, the best, because you need to have a sense of where to go and when to go there. and feel confident in doing it. So the collaboration between the deans of different healthcare programs need to get together and provide a really good foundation to the curriculum. This definitely needs to happen. And I think that just by reading that, nobody has kind of like stepped up to the plate and said, we're doing this. I believe there's a couple of programs, dental programs, that, help you to learn how to collaborate with other people, but it's not like a whole class, like a whole semester class. It's more of just like let's do this activity, which definitely helps. You get a good idea of what's going to go on, but you don't really get the grasp of actually maybe working through a patient or something like that, which would be a really, really great idea. It has been determined, remember, by the ADEA and the Interprofessional Collaborative Agency that there are 4 competencies: values and ethics, communications, roles and responsibilities of each healthcare provider, and teams and teamwork. So that's a really, really good starting place. I think just the deans of all the healthcare programs, dentistry, pharmacology, endocrinology, everybody, they all need to incorporate a semester full of collaboration in with their overall curriculum. So the students, know what to do when they come out. So interprofessional collaboration, we're all really educated and capable clinicians. We just need to kind of step out of our little box and, nobody's better than another. No profession is better than any other profession. We're all really good at what we do. We just need to, come together and help one another out, and it's for the benefit of the patient. So you're definitely helping them prolong their life a lot of times. Okay, so Bob Black, this is a really good quote. I thought it was funny because really we're not just here to clean teeth. When I read this, that's what I thought. I've had a friend who's a hygienist. She just graduated a couple of years ago. When somebody asked her, what do you do? And she said, dental hygienist. Oh, what do you do? What's a dental hygienist? Oh, we clean the teeth. Well, no, we don't just clean the teeth. And I just wanted to punch her in the face when she said that. We don't just clean teeth. We do so much more than that. And if you just know how much of a benefit you are to your patients, then you'll know. Then you'll feel good, and you'll know that at the end of the day, you're not boring. So if you have any questions or comments, there's going to be a discussion board labeled IP activity that are going to have these 4 questions on it. I'm going to look over those discussions and see what you guys came up with. I think it's going to be really fun to see your different ideas, and there's not really any wrong answers. And if you have any questions, please email me, miranda.norvell@yahoo.com. I'll try to respond within 48 hours. I will respond within 48 hours. So I'll see you guys later. I appreciate your time, and I'll see you soon. Bye.